to another broadcast of MindYourHealthCast.com. We're glad to have you back with us another week. As always, I am working very hard to bring to you some of the latest information in terms of your health and well-being and make you aware of problems to your health. Over the past several broadcasts, we have continually given you information about different aspects of what's going on in the world of medicine today, and we've talked a lot about the tremendous health bill that has accrued in this country, and actually, as I've said, it's really not a health bill, it's a sickness bill. It's aimed at managing symptoms of various problems that people have, and unfortunately at the expense of their health, because down the road they end up sicker, which requires more expensive treatments and more serious problems. So in keeping with this idea, I've been kicking around the thought that you've heard probably the expression sheep for the slaughter. And I thought that's a pretty good definition of what's happened to people today and the sickness system of this country. Now, it's probably very similar to the rest of the world. I can't speak for the rest of the world, but I can speak for the U.S., being a member thereof. But it appears to me that we just have accepted what has been handed to us, and without paying attention to the fact that as the health bill has gone up, the health has gone down. And when we look, there's more cancer than ever, there's more serious illnesses than ever, more people are dying of heart attacks than ever. Nothing seems to be improving. In fact, it seems to be getting worse. Many years ago, President Nixon declared war on cancer, and for years and years we've dumped billions of dollars into research, to say nothing of the treatments that people have gotten and the bill for that. And are we better off? I know we hear numbers thrown around, and of course statistics can be managed depending on the variables and the axis of the statistical graph. You can make things appear to be different than they are. But the fact is, there's more than ever. When I first studied medicine, there was only a small percentage of people would have cancer in their lifetime, probably 1 in 50, 75. It was way up there because I only knew of one person, I think, as far as I can remember when I was young, that had cancer. And now it's 1 in 3 for sure, and very close being on the way 1 in 2, which means that half of the people who are listening to this broadcast, unless something changes, will develop cancer before they're dead. And it may well be the cause of their death, not the cancer, but the treatment thereof. So, I thought we would talk a little bit about an attitude that seems to have developed in this country. The attitude that we became enamored with so-called science and scientific medicine. And of course, I use the term loosely scientific medicine because in keeping with the tenets of science, there's a lot of holes in the way the research is done. And in many cases, contradictory research is eliminated so that it seems that something does something that it doesn't do. But admittedly, executives of some of the largest pharmaceutical companies have been quoted as saying that drugs that have come out on the market, only about 40% of the people derived the benefit for which it was produced. Now, you're floating actually very close to placebo when you're using a drug that only about half or less of the people who take it really get the effect that they were buying the drug for. So that means if it's 40%, for example, that 10 people buy the drug, only 4 of them get the results, so 6 people have spent a lot of money for nothing. And why do we have a $1 trillion health bill, or sickness bill, which I prefer to call it? Because something is wrong. And it's strange to me how we've been willing to accept the idea that seems to be propagated by the pharmaceutical interests, that everyone in this world excuse me, needs to be on anywhere from 3 to 5 drugs, and eventually down the road 15 to 25 drugs. Now you may think that I am pushing that a little to say that, but I have had someone come in my clinic more than once, and when they gave me the list of medications they were on, they've been up to 25. And I knew that the person probably would not ever be back, because there's no way that they're going to be able to do anything management-wise to get off of those 25 drugs and try to do something else for their health. And of course, as I predicted, they did not come back because it was too unmanageable. And secondly, there's no way of knowing until you eliminate some of those drugs how many of the problems that people are experiencing have to do with the drugs themselves. You know, we always talk about drugs having side effects, but in fact they're not side effects, they're major effects. I've said that before, and I will keep emphasizing it until I hope it sticks. They are not minor side effects, they are major. But for some reason we have attuned our ears so that, number one, we believe we can't live without the drugs, and that's part of the big duping that has taken place with the American public, and probably the rest of the world, but especially it seems in America, that we are duped into thinking that we have to have drugs and we have to be on drugs. I don't know how many times I've gone someplace and saw some people sitting there talking, and number one, I would hear them say, well, my doctor says blah, 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 blah. And number two, before they would eat, they would pull out this little container with all these different pills and are popping them down before they start eating, and thinking that they have to take these pills or they can't live. And I don't know how many people have come in my office and have said that the doctor told me I have to take this or I'm going to die. And I know better, and I know pharmacology. I had to study pharmacology, and just a few years ago, 4 or 5, I did a review of another 60 hours of pharmacology, and I did 2 programs. One was 60 and another one was another 35, so it was about 100 hours of pharmacology, which is pretty close to the total pharmacology exposure that a doctor of medicine has in their training program. It's usually about 120. So it was pretty close just in the review. I understand pharmacology, I understand how it works, I understand the purpose. And if you read any of the national or international medical journals, they are full of studies that talk about a particular chemical, quote, drug, for the management of the symptoms of blah, blah, blah. In other words, they're not aimed to cure anything. In fact, there isn't any big money in cure. The big money is in diagnosis and treatment. So if they get everyone in this country on a handful of drugs every day of their life for the rest of their life, you can imagine the cost of that bill. And then you add to that the fact that they turn around and patent a drug, and therefore they can charge anything they want for it. And of all the countries in the world, this country has no price control on drugs. They can charge you anything they want, and they don't even have to justify it. And once they patent it, if you're going to take the drug, which they have convinced you you're going to need, then you're going to pay the price. And when you get pills that probably cost 3 to 5 cents to manufacture and you sell them for $20 a piece, I'd say that that's very good profit. And many of the medications are like that. Now, they can argue it's justifiable on the basis that it took a lot of money to develop the drug, but if you had to spend $20 million to develop a drug, but you sold it the first year for $1 billion, I'd say you did very well with that. That's pretty good profit, and there's not too many businesses you can get into that you can turn that kind of profit by investing a few million and get $1 billion. It just doesn't work that way. They might get another few million, but they're certainly not going to get $1 billion. But we're seeing that happen all the time. All these drugs come out and they hit big and they do a real promotion on it, and I've watched the changes. Now, when I'm talking to you, I'm talking as someone who has been around in this world for many, many years, and I have watched the whole face of medicine and medical pharmacology and medical diagnostic imaging and blood chemistries and all those things. I've watched how they have developed and how the cost has gone up. So the real big money, of course, is in testing and treating, and it's not in getting people well. And there's no incentive to get people well. If you have a business and you could guarantee that every customer that came to your business, once they bought your product, they would have to come back and get your product for the rest of their life, you could build a tremendous business pretty fast. And basically that's what's become of medicine. Now, I hate to shatter your image or your thinking about pharmaceuticals, but they really are not in business to help people. They're in business to sell drugs, and the more ways they can get people to think they need their drugs and come and buy them, the better it is for them. And that's why we have a $1 trillion bill, is because everybody has become convinced that they cannot live without the drugs. Now, we're going to emphasize what I'm going to tell you again as we talk about some of these things, but I've watched the advertising of the pharmaceuticals. Now, there was a time they didn't do any advertising. They took the drug to the doctor and said, here, we have this drug for this type of problem, and it will manage the symptoms of blood pressure or whatever it is that the person has. And so that's the way it was done. But as time went on, they realized that if they went direct to the public, they could do better and could sell more and could charge more, and they have. The problem is, and I've watched this happen, they do some research and of course you understand that drug companies have an ongoing laboratory of research individuals who are doing nothing but looking at different substances and how they affect the function of the human body. And when they get a particular substance that will shut down some function in the body and therefore turn off a symptom, then they start to look at how can they turn that into a profitable drug that they can convince people they need and have to have, or else they could have some serious problem. And so once they have done that, then they start this campaign. Now, as I say, originally they just took the drug to the doctor and said, here's what we have. Now it's gotten to the point that national television, it's pretty well dominated by the pharmaceutical companies. On primetime TV, you can bet that the bulk of the ads are going to be for some pharmaceutical substance. Now, interestingly, the next highest group of ads, it seems, at least I've been seeing a lot of them, are attorneys who are taking cases for class action suits against damage from all these drugs. And you may not be paying attention to it, but there's a tremendous amount of drugs that down the road, after the people have been taking them for a while, have turned up to cause birth defects, have turned up to cause heart failure, blood clots, hemorrhages, strokes, you name it. And yet, the public almost clamors to get these drugs to get relief from a symptom, knowing that in the ad, if they paid attention, that the adverse effects are many times, if not serious, fatal, or both, and they seem to not hear that. It's almost like we have selective hearing. I've seen ads for one that will stop your nose from dripping and your eyes from watering, and then down at the bottom they come on and say, well, it could cause blood clots, it could cause a stroke, it could cause a heart attack or death. Now I'm thinking, I think I would rather have watery eyes and a drippy nose than to have a major stroke or cardiovascular event of some sort or death. I think I'd rather hang around with the drippy nose. But it seems that we just kind of miss that. And of course I think there's another inherent thing in humankind, and that is they think, well, that's something that happens to someone else. You know, I don't have to worry. It probably won't happen to me. And so they are willing to take a risk that it's surprising to me they wouldn't take the same risk in doing a lot of other things, but they would go out and pay a lot of money for a drug that has said that it could kill you. And not even for a serious problem. I mean, I wouldn't say that a watery eyes and a drippy nose is a life-threatening problem. So to take a life-threatening drug to manage a problem that's not life-threatening doesn't sound to me like a good trade-off at all. Anyhow, I'm bringing all this up because I want to get your attention. Now, we're going to be talking a little bit about some of the history of medicine as it's developed today, and I'm going to give you some resources. I have laid out some books. Over the years, I have read thousands of books and have gone through huge stacks of research papers and all the things that are going on. And when I do whatever it is that I want to learn it well. I don't want to know it just superficial. And so, as a result, I've acquired almost 25,000 books over the years in a library, and those that are readable, meaning the ones you can sit down and read, they're not reference books, I have pretty well read most of them, or at least large portions of those that had significant information for me. So anyhow, I just brought out a few books today that I thought may be helpful if you are really serious about wanting to know what this whole subject is about, number one, and number two, what it can do to you if you take all these drugs, even on an ongoing basis. Now, when I studied pharmacology, it's interesting because they say right from the beginning, there are no studies out there that can tell you what will happen if you take 3 to 5 different medications at one time. There just are no studies. It's not possible to take every drug and compare all of the other drugs with that, and that if you took 2, 3, 4, or 5 different drugs, what those would do together. Can you imagine the expense of doing a study like that? I mean, we're talking about millions of possibilities. So that just isn't done. Once in a while, it becomes so obvious that somebody drops over dead when they're taking one drug and they take a second drug because they counteracted each other, and so those will be in the warnings. But apart from that, they don't know. And in pharmacology, they say right out that if you're taking 3 different medications, the chances are at least 20% that you're going to have some adverse effect because of taking those 3 different drugs. That it's going to create a new problem. And when you get up to 5 or 6 drugs, you're getting up to 60 to 70% likelihood that that's going to happen. Now, what about somebody that's taking 10, 15, and 20 drugs? There's 100% likelihood that there's going to be some adverse effect. Now, I've mentioned before, and it's kind of funny in a way, but it's not funny. It's very serious. I came from northern Ohio to Florida about 36, 37 years ago. And before I left, I remembered reading about a pharmacist at a local hospital. Now, this has been a long time ago. And this pharmacist was becoming more and more disillusioned with the way drugs were dispensed to people in this hospital that he worked. Until finally one day, he received prescriptions from several doctors for the same patient for about 52 or 53 prescriptions. None of those doctors had really taken the time to find out what all the person was taking. They just each came in, looked at him, did whatever tests they were going to do or asked whatever questions they were going to ask, went out and wrote a pile of prescriptions. And so 50-some prescriptions came in for the same patient. The pharmacist got up, took off his jacket, and said, "I quit. There's no way I'm going to give 50-some drugs to this patient. There's no way of knowing what it could do to him, and the likelihood is that he will either be damaged or killed from it." And so he quit. And this happens all the time. I see the people come into me. They're seeing 2 or 3 different doctors for different things, and they come in with 5, 10, 15 drugs. I mean, that's very common that they've been taking. And in most cases, after a while, the drugs they're taking are trying to offset the symptoms of the adverse effect from the other drugs they're taking. And it just goes on and on and on. And now I'm saying all this to say, I'm not saying there's never a time in your life that there may not be something happens, that you may not have to for a while take some type of medication. But to take on an ongoing basis all of the drugs that people take, I've had people who their drug bill every month was $900 to $1,000, and they were on Social Security, and that was actually more than their Social Security. And out of that, they needed to pay for their house, food, and other expenses. And so they were going broke. And they were worried because they were afraid if they didn't cough up the $900 every month for those drugs, they were going to die, because the doctors who prescribed them says, if you don't take this, you're going to die. But you know that really hardly ever would happen. I'm not saying it's not possible under some very unusual situation and some very serious condition, that at least for a period of time, and I suppose in a very few cases, maybe on an ongoing basis, someone might need to take a drug. But what is that telling you? It's just telling you it's managing symptoms and it's not working toward correcting the problem. But then that's harder and takes a lot of work. But it's much simpler to give people relief, and the people feel happy because now they don't have the symptom anymore, and they never bother considering what it's doing to them now or down the road. And I mean, we could go on with several medications that are given for something that's not really a problem, and even false information is given out. And unfortunately, that's leading to some serious problems of health, because I end up seeing the people that have gone through all of these serious problems. So we want to talk just a little bit. I've said it over and over enough times, I guess, about masking symptoms, that if you remember the homotoxicology we talked about, you understand that symptoms are not bad. Symptoms are telling you that there's a problem. Your body's working on correcting it. The symptoms are not from the disease as a rule. It would be very unusual if that were the cause of the symptom. The symptom is the immune system trying to take care of the problem. And so we take all of these medications to try to get rid of those symptoms because they're uncomfortable. And people who come to see me, unfortunately, the things I give them actually activates the immune system, so we find in their case the symptoms actually can get worse for a while. Fever can go up for a while. They can have aches and pains all over. They can have a sore throat. They can have a dull headache. They can have a stiff neck. They can have achiness everywhere in their body. All their joints can hurt for a while. All of those things are not bad. If they're coming as a result of your body cleaning out, then they're good. That means that the immune system is doing its job. And we don't even have time to discuss today about the immune system, and that will be at some point a subject in itself, where we go into detail about the immune system and what it is, how it works, and I dispel another myth about autoimmune illnesses, of people being told that their body has got a problem with the immune system and it's attacking healthy tissue. The immune system does not attack healthy tissue. It attacks poison tissue, trying to get the poison out. And so the secret would be get rid of the poison, then you don't have the immune system trying to get rid of it. And that isn't, as I say, a subject for another program, and we will get into that coming down the road. In any case, what we want to do is talk a little bit about why medicine has gotten where they are, I guess. I would say back in about 1980 plus or minus, there's a medical doctor by the name of Robert Mendelsohn. I'm mentioning his books, and having read those books, they were eye-openers. Back then, around 80, I knew less about medicine, of course, than I know now, and I haven't done the tremendous amount of research once I really got a feel for what was going on with medicine that I have done to this point. And of course, other people have done the same. That's why a lot of books have come out talking about all of this, but unfortunately, they never hit the bestsellers list. They don't get on any of the book reviews. They don't get on any of the TV programs where they talk about it. It's pretty rare if that ever happens. And yet, some of these books are extremely significant in terms of getting you aware of what's going on in the health field today. But Dr. Mendelsohn was, to me, one of those people who went into medicine to help people. He's out of the Chicago area, and he at one point taught medicine, and he also was on the board of medical examiners in Illinois. And so he was actually a very good doctor with an impeccable record. But one of the first things that got my attention was that he had written this book called Confessions of a Medical Heretic, and that came out originally in 1979. And when I read that book, it was a real eye-opener. Dr. Mendelsohn had been in practice by that time for many years, and he was recounting some of the things that he had learned and found out about medicine over the years as a conscientious doctor really trying to help people. And so one of the comments he made was about the use of pure oxygen in preborn, or I should say premature born children. It was a practice in the big hospitals that when there was a premature birth, they would put them in an incubator with actually pure oxygen being fed in. And in many cases, the child ended up blind. Now, there were people suspecting that the pure oxygen was too much and that it was causing a problem, but the people refused to bend in the hospital. That was the practice or the policy. They used pure oxygen. So they continued to do it and continued to have these children develop blindness. Now, down the road was a hospital that was much poorer and catered to a poor group of people. And when they had a premature birth, they had an incubator that was actually defective in a sense. It leaked in a lot of air and lost some of the oxygen, so the baby was getting diluted oxygen, and they were rarely ever having blindness. And even when that was pointed out to the other hospital that was using the pure oxygen, it took years to ever get it changed. And in the meantime, a lot of children were blinded because of the fact that they were recalcitrant. You know what that means? It means stubborn to a fault. They were recalcitrant about making a change. And unfortunately, the medical establishment in this country has kind of been that way. Once they start doing something, they keep doing it even after evidence is showing that it's either non-effective or it's more dangerous than the supposed effect that it generates. So anyhow, that was one of the things that Dr. Mendelsohn first encountered that kind of opened his eyes. And then as time went on, in his early training, he remembered that he was doing some intern work at a hospital, and they had him in the emergency room for a late shift. And in the emergency room, they had people come in who would have all kinds of things happen. It wouldn't make any difference. It could be a cut, a fall, a broken bone, pain of unknown origin, severe vomiting, diarrhea. I mean, just a wide variety of symptoms that the people came in with. Well, anyhow, one of the things he noticed that was strange to him was that any young boy who came in to the emergency room who, no matter what the reason they came in for, whatever accident, whether it was a cut, bruise, broken bone, or, as I say, vomiting, diarrhea, or whatever it was, no matter what he came in for, there was a standing order in the emergency room that the physician was to refer them over to nephrology. This boy, if he, under two conditions, one was over 5 or 6, and number 2, still wet the bed. So when they asked in their history, does this child still wet the bed, and they said yes, the standing order was him or whoever the doctor on call was to send that child over to nephrology, which is, of course, the department for kidneys. And so after a while, he began to question that. Now, why would they want to send a child who came in with a broken arm, for example? Why would they want to send him to nephrology? And so he started doing some inquiry. And it ended up that he found out that in the nephrology department, they had doctors who were specializing in nephrology. And as a part of their specialty, they had to do so many catheters into the bladder to get their certification. Now, if they didn't have enough adults that had problems that they had to insert catheters, they were using these 5- and 6-year-old boys to practice on. Now, the downside of that is that their urinary apparatus is too fragile at that point, except in an emergency, to be inserting catheters. But they were doing it anyhow, and in many cases, I'm sure they damaged the urinary tract and created the child down the road problems just because they wanted somebody to practice on, and the hospital was condoning and actually contributing to it. So it was things of this nature that got Dr. Mendelsohn concerned about some of the ways that medicine was going. So consequently, he actually put out this book as time went on, Confessions of a Medical Heretic, and what he was saying is, number one, as time has gone on, medicine has taken some directions that he thought were very poor in terms of the health of patients, and he wanted to make people aware of it. And in fact, he made the famous statement, one of the worst things you can do for your health is go to a hospital. And his book was very good, documented, and he was not somebody looking for a lot of controversy. He had a true concern for the health of people. And so to me, that was an eye-opening book. I used to keep one in my waiting area for people to take home and read, or read while they were waiting. And the book is still available through Amazon, and I would get it and read it. Now, I understand it's a little dated now, but it's dated now to the point that he was conservative compared to what's going on now. But it shows what a true doctor who really wants to help people, what he was wanting people to know. He's wanting them to know that there are things out there that are being done by medicine that are dangerous. And I've seen him in debate before on TV and with other doctors about some of the practices, and a couple of them I've seen get angry and yell and scream on TV because of what he said. And really what they wanted to do was shut him up, because they were afraid that he was going to provoke a lot of people to start thinking for themselves. And he did. He also talked a lot against immunizations and antibiotics, the way they're abused, and a lot of other things. And it doesn't surprise me that down the road, as I say, I knew him, down the road he started testifying in cases where the medical establishment was trying to put out of operation people who were doing natural medicine. And so he started going in as an expert witness against medicine in favor of the natural medicine. In fact, it happened to a friend of mine out in Nebraska. They were being taken to court, and we talked, and I said, well, why don't you contact Dr. Mendelsohn in Chicago and bring him in as a witness? And so this friend of mine did, and of course what he said shocked the prosecutor, because they thought as a medical doctor he would be agreeing with them against the other person. So it worked out very well, and later a friend of mine in Georgia had a similar problem. They sent him an order to cease and desist doing natural medicine, and so it became evident it was going to go to court. And so he ended up that he hired an attorney, and he talked to me, and I said, I think that you probably are better to handle this yourself or go some other direction. The attorneys don't understand, and besides that, they have no interest in learning all that they need to learn to handle this properly, and you're going to pay a lot of money and get nowhere, which ultimately that happened. Finally, he called me one day and said, I agree with you. It was a waste of money. I went into a hearing, and the judge told me that the attorney not only filed it all up because he didn't file it properly, didn't even understand the issues, and that he should have a malpractice suit against the attorney. That's what the judge told him. So in any case, he said, I guess I'm going to handle it myself. I said, why don't you contact Dr. Mendelsohn over in Chicago, and I'm sure you could get him to come and testify as an expert witness. So he contacted Dr. Mendelsohn, and everything was set, and 2 weeks before the hearing, Dr. Mendelsohn mysteriously died, which is interesting about someone who was not unhealthy and nor had any health problems. I always have had suspicions about what really happened with him. He had become a thorn in the side to medicine. He was outspoken, and he was correct about what he said. They couldn't refute what he said, so they tried to shut him up in general. And it ended up that when he started testifying in court cases against medicine, I guess they decided that was too much, is what my feeling is. Now, that's my opinion. I can't prove it. All I know is he wasn't sick. He didn't have any health problems. He did take care of himself. He understood natural medicine also. And all of a sudden, he starts testifying, and he suddenly dies. At any rate, he had such an impeccable background that there was nothing they could pick on as far as trying to discredit him. So to me, the only thing left was to get him out of the picture. Anyhow, he wrote a couple other books, and I think you would find those worthwhile reading. The second book he wrote was called Medical Malpractice, M-A-L-E, and he talked about how women are exploited by medicine with their problems, and how that they have done all these routine things that don't have to be done, but they get away with it because no one questions it, and so it becomes a big routine. I know I've watched it happen, that women who have had cervical dysplasia or have had some type of uterine issues, and the patient would go into the doctor and they would say, well, we're going to freeze the cervix. And so they would use liquid nitrogen to kill the superficial layers of the cells a time or two. And then they might send them in for a D&C a time or two. And then from there it went to hysterectomy. And that was always the progression. I knew in my mind after a while that the doctor seeing the lady was thinking from the time he first saw her, we're going to be doing a hysterectomy, but if I tell them outright that's what we want to do, they might be opposed to it. But if we run them through some other procedures first, and then they still have problems, then we'll have no trouble convincing them, we'll just do the hysterectomy. The reason I know a lot about it is I had a lot of patients with a lot of issues that did get well. One in particular I remember was a lady who came to me by referral who was in probably her middle 20s, and she was having some issues with reproductive organs. She went to her doctor, and he said, well, I think we should just do a hysterectomy. And she said, well, I don't want to do a hysterectomy yet. I'm only in my 20s, and I haven't had any children yet. I don't think I want to do that. And he said, well, go have a baby, and then we'll do a hysterectomy. And she said, I'm not married, and I don't want to just go out and have a baby. And so then he says, well, we should take your gallbladder out. And she had a shocked look on her face and says, my gallbladder? I'm not having trouble with my gallbladder. Well, you probably will down the way. And she became so irritated at this doctor that she never went back, actually. And I still know her. I'm still in contact. She's out in the Northwest right now. And she never did have the hysterectomy. And I would say she's in her 50s, probably pushing 60 now, and never had to have the hysterectomy. I think those type of surgeries are done routinely, in most cases not necessary at all. There's other ways of dealing with and correcting problems. Unfortunately, the average person is unaware of it, and most cases believe, well, if the doctor says it, it must be true, and they go do it. And so anyhow, Dr. Mendelsohn addressed a lot of the abuse of women in terms of medical procedures in that book, Medical Malpractice. So I would say that's a good one to read. And later he published a third one, which came out in about 1987, called How to Raise a Healthy Child in Spite of Your Doctor. And he then dealt with all these issues of the ear inflammations and throat inflammations and the abuses of antibiotics and all of that, and how all that stuff is not necessary, like it's been abusively been used. I had an acquaintance in Alabama who was noticing that the local doctors in his area, he was secretary of the local medical society actually, and he noticed a lot of the doctors were pouring antibiotics into kids for colds and flus, and he knew that that's useless because colds and flus, the viruses are not affected by antibiotics, so it's a waste of time and actually creates other problems. And so he brought it up in a medical society meeting, and they were offended that he would not want to go along with the idea that the doctors were doing that to show their people that they cared and were trying to help them, even though the doctor knew what they were doing was of no benefit. They thought it was helpful for the person to know they were doing something. So they actually, as a result of it, he ended up in big trouble, and phony charges ultimately were posted against him. He ended up 2 years in prison, all because he created a problem of trying to have the doctors have more of a conscience about the way they administer drugs. So if you want to get just an inkling, and that's all I'm saying is an inkling with his books, because these were done back in the 80s, plus or minus, and if you think it was bad then, that's nothing compared to what is happening today in the medical field. So they are a good starting point, though. It does kind of open your eyes a little, and some of the books I'm going to be talking about now are going to, they ought to open your eyes a lot. And I'm not trying to turn you against medicine. I'm trying to turn you against being abused by medicine or being a victim of medicine or taking what's handed to you without raising questions. I want you to be an informed consumer. I want you to ask the right questions. There's no way I would ever have time to tell you of all the stories I know where people were injured, killed, or permanently disabled because they didn't ask questions and because they just took what was given to them. And I'm not saying there's not some good doctors who are conscientious and do the best they can with the tools they have. But I'm going to say that most doctors, even if they're conscientious, have to be careful, because in this country especially, medicine is so tightly controlled by the medical establishment that they are required to follow certain procedures. Number one, whether they work or not. Number two, how dangerous they are. And if they don't do it that way and they decide to strike out on their own, many that I have known of have lost their license. So they are not allowed to have the freedom, even though they've passed some of these medical freedom acts in certain states. There's a point you won't cross over or you can lose your license. And I've known personally several doctors of medicine who have lost their license, and I know that the threats have been out there for some of the osteopaths who normally were a little bit more liberal as far as their licensing scope. And what most people don't understand is that even from state to state, it's not the same. The Medical Practice Act defines certain ways in different states. And the practice of chiropractic, the practice of osteopathic medicine, naturopathic medicine, whatever it is, if it's licensed, it can be different in different states. I know chiropractic, there's in Oklahoma, they can do injections and IVs, and they can do certain things with vitamins and so forth that they can't do in other states. I know in the Northwest, there's one state where they can deliver babies, but they can't in any of the other states. So it just depends on the way the licensing developed and whether they may have been able to change the scope or whether it stays the same. So anyhow, when I was young, I remember medicine as it really started out, that the doctors were people who, number one, didn't make a pile of money. They worked 7 days a week and sometimes all night long. They were willing to go out to people's houses no matter what the weather was like, in blizzards, snowstorms, and whatever, with emergencies or childbirths or whatever, and they had a concern for their patients. Now that's the way I originally remember it. They didn't have all the tools. They didn't have a hospital in every town. They didn't have a blood lab to send off immediately and get a blood workup. They didn't have an imaging center to go and do all these imaging. They had to be trained in diagnosis way beyond the doctor's training today. To pass the program back then was much, much more difficult than it is today. Anyone who can get into a medical school, meaning they have the money and their grades are not too terrible, are going to go through the school. They're going to pass because they don't really need to know a tremendous about diagnosis and about physiology and pathology and all that. What they need to know is, if you have this symptom, what drug do you take for it? So they either have to have a very good memory to remember what drugs to give for what symptoms, or they have to have a good PDR or reference book close by that they can go to pick the information out of. But when they are trained, the bulk of the training has to do with knowing what drugs to prescribe for what symptoms. So when they go in their internship, most of them there learn the drugs of the doctor who's in charge of them in their internship. And when they go out on their own, they usually start out with the group of drugs that this doctor was using and that they were taught something about. But it was all based on symptoms. In fact, it still is. It's what I call symptom treatment, with little concern for whether you're going to find the cause of the problem and correct it. In fact, the pharmaceutical would rather you didn't correct it. They would rather that you made the people happy by managing their symptoms and have them keep coming back for more and more drugs. Now, of course, eventually the drug won't work anymore because your body can build a tolerance to it, so then they have to come out with more powerful drugs, and then you switch to the more powerful drug. However, the more powerful drug has more adverse effects, so now you are creating other problems. Many, many times the people's illness ultimately is caused by the treatment they've had over the years, which is called iatrogenic illness, which is caused by the treatment. And therefore, you're going to be coming back over and over and over. And the pharmaceuticals, actually a major executive of one of the largest pharmaceuticals in the world, was interviewed by Forbes magazine, and he made the comment, there's two big comments. One was that the drugs they use are probably only about 40% effective for the symptoms they're prescribed for. But the second big thing he said was, we want to become like Wrigley's, meaning Wrigley's gum and Wrigley's candies. We want to be in every household, and our next big market, now this was said several years ago, and I read the quote. He said, our next big market is we want to get well people on drugs. Now, how do you do that? How do you get well people on drugs? That means that you start creating a problem that doesn't exist. And once you've created this problem that doesn't exist, you then wait till people are concerned and worried, because the average person doesn't know much about their body, and they don't know much about illness, and they don't know what symptom is serious and what isn't, and so they rely on the doctor to tell them that, or the medical establishment. And so consequently, we've been programmed to watch the TV commercials, and if they say, if you have this, this, and this, you may need this drug, see your doctor. Well, in about probably 98 to 99% of the cases, if you go see your doctor and say, I want the purple pill, you're going to get the purple pill. And the doctors love it too, because they don't have to worry about thinking, or at all, you come in asking for the purple pill, and if they can give you a couple of symptoms that sound like you might have a problem related to what the purple pill was put out for, then no problem. You give the person the purple pill. So it's very easy to sit there and write prescriptions, and I think I've mentioned this before on my broadcast, but one of my patients came in and was telling me, this has been a while back, that a new doctor came into the town that he lived in, here in Florida, and the doctor had an interesting way of working. He said this doctor did not take appointments. Everybody went in and waited their turn in the waiting room. And so what he found out was that if you were in line when your turn came, you went into the room where the physician was, and he was sitting behind a desk, and you sat on a chair on the other side of the desk, and the doctor said, what do you need today? And the person would say, well, my throat's been sore, I think I need some antibiotics. He would write out a prescription for antibiotics, and out the door, the next person come in, well, I've been having some pain in my shoulder. I think I need a painkiller and maybe an anti-inflammatory or whatever. Okay, he'd write it out and out the door. No examination, no testing. Whatever they needed, that's what they got. And so that's an extreme, but nonetheless is kind of the way medicine is practiced. I've heard some doctors in recent times complain that they're really getting tired of medicine because all they do is sit all day and write prescriptions. And that's pretty much the way it is. And I've had people come in. One lady came in a while back and she said, I had forgotten what medicine was like, but something came up, and so she decided to make an appointment with her local physician she had not seen in a long time. She went in and sat down. He had her file on the desk open. He didn't look at her. He was looking at the file. and she told him a couple things that were bothering her, and he reached in the drawer, pulled out his prescription pad, wrote her a couple of prescriptions, handed it to her, and she said never once did he even look her in the eye or ask any questions. And as I say, that's the way it's gotten to be. It's like an assembly line. You give whatever the symptoms are, you give them a drug, get them out the door, and next. I've jokingly, but maybe not so much a joke, said that I think many of the doctor's favorite words now is next. And the more they can move through in a day, the better it is. And I know that there can't be too much thought when you have a 5 to 10 minute visit with someone. You can't be giving too much thought about what's going on with them, what their causes are. And generally what the procedure is, if after 2 or 3 visits of prescribing they still are complaining, then you say, well, I think we need to make an appointment for you with a specialist about this. And they're out on the next merry-go-round, and they go through the same routine with that doctor. So, unfortunately, that's costing a big pile of money, and people are not getting well, unfortunately. In fact, they're not only not getting well, they're actually getting sicker. There's more chronic illness than ever. And the one thing that is never listed on the causes of death, and you know, it's always cardiovascular first, it's always cancer second for the causes of death in this country, but about number 3 to 4 are, and it's probably only 3 because all the cases don't get reported, but death from adverse effects of drugs or reactions of more than one drugs or misprescribed drugs. And that one, it never has been in the list. But when you look at the numbers, it's of reported cases, should put it at number 3 or number 4 for the causes of death. But for some reason, we are operating in a state of cognitive dissonance. It's as though we know a lot of these things, but if we get a symptom, we immediately run to a doctor and want a chemical to see if we can't feel better, not get well, but feel better. And if we feel better, then that's fine until the next thing comes up. And we're content to do that in this country. And whether the people have been brainwashed, whether they've been put into a trance, I don't know. But it's as though they don't notice, as I say on the commercial, when it says all these adverse effects, they just don't seem to notice that. They go on and take the drug. And in a few cases, I've even heard people complain about the adverse effects or complain about the way medicine is done, yet they still go and do it. As though, well, that's the way you do it. So I mentioned about sheep for the slaughter, and it's almost sometimes like the people in this country have become a bunch of sheep, and they just follow the crowd. So if everybody goes to the doctor, and the same thing happens when a new doctor comes to town. Some of the people that go to him will go tell other people, oh, you should go see this doctor. You know, he's blah, blah, blah. And so the whole herd goes over to that doctor, and so they just bounce around. But I think part of the problem is that we've developed this attitude of speedy Alka-Seltzer. We want our symptoms taken care of immediately. We want to feel better. And number 2 is that we don't want to be different than other people. I mean, we don't want to go see some off-the-wall person that does something a little strange because, you know, you're not up to speed if you're not doing what everyone else is doing. So we see the same thing going on and on and on. Now, we've got a lot more material here. I was asked by my producer, is this going to be a 2-session or a 1-session? And I said, well, probably 1. But when I look at some of the things that we need to cover yet, I have to say it's definitely going to be 2. But I want you to, on the next broadcast, come with a pen and paper. Now we're going to post it. I've got the books out and I'm going to give them to the producer to make sure they get posted on the site. But some of these books are so powerful that if you have any concern about your health at all, you're going to pay some attention to what's going on. Not only in general, but some of the things that I'm sure a high percent of you either have been taking, or you will be taking, or you've considered taking. And we've talked about like cholesterol before, but I want to hit that a little harder at this time, because that's an example of people following bad information and destroying their health in the process and thinking they're doing themselves a favor. But there's a lot of other stuff out there. We're going to talk a little bit. This is not going to be about cancer, but there's one book I want to introduce you to. You can read it yourself, and we'll bring that up at the next broadcast. But we're going to do a full program on cancer, which will probably be at least a couple of sessions or maybe longer. It's very involved, and there's a lot to consider. So that one's going to be big, and I've mentioned age, which is likewise going to be big. But what I'm talking now are just the more simple levels of medicine and the way it's practiced, and the dangers of some of the things that are being done that people don't give second thought to at all. They just accept it. And they've accepted some things without any evidence to support it, but the propaganda of the pharmaceuticals have done what I said earlier. They end up creating a need. In other words, they come out and say, here's a problem. Then they really merchandise the idea that how bad this problem could be. Not necessarily is, but could be. And then at some point, when enough people are saying, well, what can we do? Then they, of course, come out with the solution. And, of course, the solution is one of the drugs, which they already had in the background, and that's why they started the campaign in the first place, to make you aware of what is not really a problem, but they're saying is a problem, and you're willing to buy that it's a problem. And cholesterol happens to be one of those. And so we're going to use that as a big example, and we're talking about people who actually worked in the industry as a chemist. One of the people I'm going to be talking about, they worked in it as a chemist, and they actually know the whole story about cholesterol and the statins and so forth, and the dangers of actually taking it, not only because of what it can do to your liver, but secondly, the danger of what can happen to you if you push your cholesterol down. And that people don't consider at all. Plus, there's several lies that have been propagated to the public, and this person talks about it. In fact, the one book that we're going to talk about is called The Hidden Truth About Cholesterol-Lowering Drugs. And this guy was a chemist with the pharmaceutical that made statins. And they know all about it. It's not that they're stupid and they don't know what the drugs do, but as long as they can bilk the public and get the public to buy it, they're going to do it, and they're going to make a lot of money. At one point, they're taking in $26 billion a year just on statins. That's just one drug. But if you can imagine why the health bill is so high, taking this cholesterol is not only not going to prevent heart attacks, which it doesn't, but it's actually going to shorten your life and can destroy your liver in the process. And so we'll talk about that a little bit. And some other things you probably haven't considered. And one of the big books is called The Politics in Healing, and that's about the cancer industry. And that's one that we're going to get to you. And then we're going to talk about how you're being merchandised. Your body is being merchandised. And if you haven't thought about it, it is. So, we have run out of time again. We want to remind you to go to our website, mindyourhealthcast.com. From there you can click to this broadcast, as you probably know, or you wouldn't be watching it. And we'd like you to tell other people about it. At this point, we still are keeping it at no cost to you. We're bearing all the expense of providing all the information and not trying to convince you to my way of thinking. I'm trying to tell you what my opinions are and why my opinions are like that, and I'm giving you references. If you go to the website, the books are there. So we've run out of time again. So remember, if you want to go directly, you can go to freedocast.com/mindyourhealthcast, or you can click from our website, or you can click to our alternative medicine website, alternative health and prevention. And in that website, find out more about what we do in terms of therapy and get some good information off of it. So it was nice being with you again. We look forward to seeing you at the next broadcast.